Dr. El-Bayoumi. It's wonderful to have you here. We welcome you, and we're very thankful that you're taking valuable time from your schedule to talk to the Karama women worldwide, by the way. This is going to be listened to in places as far as the Philippines and various parts of Africa.
And well, it's my absolute pleasure to be with you. It's an honor, and anything that I can do, I'm at your service.
Thank you so much. Let me just say a little bit about you. You're an Egyptian-American woman born in Florida and raised in East Lansing, Michigan. You're a professor of medicine and have a very active clinical practice. You teach at George Washington University in Washington, D.C. You're with us now. And right. You actually studied in Ann Arbor, Michigan, for both your undergrad and your medicine. We'll talk a little bit more about your various interests in medicine and in social service, actually. You view your knowledge as important in the service of the people, and we really like that about you. So could you please just start telling us about the unfortunate current crisis that everybody is either worried about or too worried about, uninformed about? Whatever you would like to say about the coronavirus situation, we would love to hear it.
Of course. So COVID-19, or coronavirus as it's sort of referred to in popular terminology, is a novel or new virus. And that's the issue of why it's been so deadly. In other words, we have never been exposed to this virus before, so we have no immunity against this virus. So people who have depressed immune systems, people who are elderly, people who it turns out are diabetic or very overweight, certain chronic medical conditions such as cancer, such as heart disease, lung disease, are especially prone. One sort of bright spot in this really negative story is that it does not seem to impact children or pregnant women. You know, at the very beginning when this crisis came out, we thought that it was really a disease that only impacted the groups that I've mentioned, and it was a disease of the elderly. It turns out that that's not true. While the death rates are definitely higher in the groups that I've mentioned, people that are, you know, young in their 20s, 30s, 40s have also been impacted. They get extremely sick. They just don't have the same rates of death as people who are older. So there have been a lot of myths around COVID-19. And of course, as we learn more, both scientifically, through our clinical experience, and of course, through our public health systems, and we're sharing all this information, not only across the country in the United States, but just as importantly, if not more importantly, internationally with such places as China, as Italy, as Spain, which have really been hit hard, we can advance our information and knowledge. I will say one thing, and that is I am giving you the best information, the most up-to-date evidence-based information that we have now. As more information comes in, we can update our knowledge. But I always say that as a disclaimer because I think it's important that people realize that this is a new virus. Our knowledge is really at its infancy. And so we are trying to do the very best in a crisis.
Is this as a new virus, is it naturally developed or is it developed in a lab? That's one of the issues that have been going around in...
Yes. So there are a lot of conspiracy theories that are abound, especially in sort of our parts of the world and not the United States, certainly among here in the United States, among Black and Brown communities. And I have to say, there are reasons for those conspiracy theories. For example, in the United States, when the white man came into the United States, they actually introduced the first type of biological warfare by giving blankets to the Native Americans that were infected with smallpox.
Yeah.
However, in this particular circumstance, this is not the case. This is a virus which had a naturally occurring reservoir among bats, and there was a jump from bats to humans. That's one of the three theories around HIV as well. And as we live in sort of closer proximity with animals, that's one of the byproducts of how that can happen. So, you know, coronavirus is a group of viruses, and the not COVID-19 actually causes a lot of the common colds, but this particular type of virus was in a reservoir of animals. And if you see sort of the news these days, now that human beings are really in their homes and so forth, you've seen animals come into cities. In Paris, it's pigs. In other parts of the world, it's monkeys, so forth.
Really?
But this tells you that actually human beings have actually taken over places where animals have been. So it is not something that was made in the lab. It is something that actually jumped from animals to human beings.
And what do you think in certain parts of the world, we are told that one way to handle all this is to have a lot of curcumin and ginger and garlic. And as a doctor, what do you think of these kinds of
So I think that for sure, things that improve your immunity, and the cornerstones include good sleep. Sleep, especially, from our part of the world, is something that we really value and see as essential to good health. Here in the United States, people don't get enough sleep. It's almost seen as, that they're great because they're not sleeping enough. But sleep is essential. Eating a healthy diet, especially one that's rich in fruits and vegetables and all of the spices that you just mentioned, that is something that's, very essential to good health. And then, of course, trying to reduce our stress. It's a very challenging time from the standpoint of stress reduction, but people have relied on their faith, right? For those of us that are Muslim, to be able to be centered and to look to our faith traditions, no matter what they are, I think is important. Our sense of family and sense of community is important. So those are things that can help with immunity, but really the most important things in the immediate from the medical standpoint is hand washing. Hand washing that is not just, quick hand washing. And again, this is one area that from a cultural standpoint, we actually have a jump on, right? Because
yes,
we value hand washing. I mean, look, praying 5 times a day, cleanliness is very important. And then the other thing of physical distancing 6 feet or more. And then certainly when you're going outside, which you really should try to minimize, putting on a face mask and gloves. Because the reality is that, I don't know about you, but I actually touch a lot of surfaces, right? We
yes.
handle doorknobs, we're in elevators, rails, we lean against walls. So gloves become quite essential. So all of the things that you've mentioned are important. But in addition to that, during this time, in overall, hand washing for at least 20 seconds, with good soap, and I would say make sure that you're washing in between your fingers, the back part of your hand. I also include, my forearms. People also tend to forget about washing their face with soap and water, and remember, it's 20 seconds. So you can sing happy birthday twice. That's an easy way. Or
how many times saying the Fatiha?
Well, we'll have to probably once, right? One time. Yeah, I would think. I have to count it out, right?
Yeah.
Because it has to be 20 seconds.
Yeah.
But hygienic practices are really key, because what they do with the soap and alcohol is not, all the sanitizers are not enough. If anything,
really?
No, because the alcohol can dry out the skin. And remember that the skin is your first barrier against infection. So if there are cracks in the skin, if it's overly dry, that can actually make you more susceptible to infection. Soap and water, how the virus actually is, how it looks. It's actually a very tiny molecule, but basically it has areas that are very susceptible to water and soap. So soap actually disrupts the layer of the virus and make it unable to infect. And that's why soap is so important, soap and water.
It's good to know this because everybody is rushing for alcohol and sanitizers and I couldn't find them. I thought I'll settle for the next best thing, which is soap. And now you're telling me, no, that's much better. But what do I do when I go out? What do I do about my clothing and my hair, for example? Is it true you have to shower whenever you come back and include your hair?
It sort of depends. It depends on, you know, where you're going. I think some of the high-risk places are actually grocery stores because you are, you know, handling products. I would really recommend that people not pick up any things to look at, but rather to go with your list, know what you're going to purchase, pick it, and then try to leave. We do recommend.
If you have gloves, it's okay, isn't it?
Gloves are important, but you got to wash your gloves when you get home, right?
Okay.
And so, you know, I've been doing a lot of laundry. Of course, I'm in a different situation because I'm going into clinic. I haven't started going to the hospital yet. That's going to probably happen in a few weeks. It also depends on who else is with you at home. If you have people that are especially vulnerable, yes, take off your clothes when you get in and then jump in the shower, right? Because you know, we're at different levels in terms of the susceptibility of our loved ones. So, for example, I live alone. That's less of an issue. But I know people who are taking care of their mother who's 73 and their grandmother who's 93, and she works in a clinic. That is somebody that really needs to be vigilant and careful about, you know, washing her clothes, washing her face, showering, that's not a bad idea, and really almost spending time in a separate room, if at all possible, really minimizing contact.
That is a stressful situation at a time when you don't need stress, right?
Well, and you know, I want to tell you something. They've actually done studies before all of this happened. Do you realize when you fall in love, your immune system improves, and then when you break up, it goes back down and actually is suppressed? So no doubt that stress impacts our immune system. And that's why sleep, meditation, prayer, you know, there are different things, that music, the arts, you know, knitting, things that bring you calm. Actually, if you have animals, I have 2 cats, petting them is very relaxing to me.
It can jump to the cats or back from the cats to the human, right?
No, actually, they've done studies. Right now, it does not look. If anything, we as humans can give it to the cats, but not the other way. And same with other animals. It does not seem at this point that they will get us infected. It's more like we're getting infected. But other things that I would say is nature. And they've done studies that if you can't go outside, just looking out the window, even having, for example, a picture of the ocean and looking at that can actually help your immunity and help you just relax and calm down.
So let me just ask you, we jumped into all these important questions, but let me go back a little bit to the basics. Now it is spring, and it is likely that we'll have some spring allergies, runny noses, even low-grade fever sometimes. How do we know to distinguish and whether we should worry or not?
Yes, I've gotten a number of calls from my patients about exactly that topic. And so what I will ask them is, what is your usual pattern? Do you usually have these symptoms around this time of the year? And what do you usually do when you have them? And if they say, look, this is usually the season, I take a medication over the counter, I'll say, let's try that. However, if you develop the following symptoms, then I want you to call me. And the following symptoms include sore throat, headache, body aches, a sense of extreme fatigue, cough, shortness of breath, even diarrhea, because we now recognize that almost 50% of people who have COVID or the coronavirus may have gastrointestinal symptoms. So those are the other symptoms. And I should mention that the fatigue is overwhelming fatigue. People say that they've never felt this degree of fatigue. And the fever is not low grade, it's actually extremely high fevers. So in Celsius, it's 103. In Fahrenheit, it's, or the reverse, I should say, it's 38, 38, 39 even. And so it can be difficult to distinguish. I would say talk to a clinician, and a clinician that has some experience, because initially what we were telling patients was different than what we know now that we have a bit more experience.
Maybe we should talk now a little bit about the possibility of a vaccination and all the studies what do you expect? How soon do you expect it?
Well, this is where federal policy has had a very negative effect. At the George Washington University, I had a colleague, Dr. Peter Hotez, who's now at Baylor, and he actually had been working on a vaccine around a type of more, not this particular COVID, because it wasn't around yet, but a different kind of more virulent or dangerous strain. And in 2016, the current administration cut off the funding. So it is estimated that it would take between 12 and 18 months.
Wow.
Because remember, the reason it takes so long is not just in the preparation of the vaccine, but we have to make sure it's safe, right? We're of an age where we can remember in the United States back in the 70s when they had the swine flu vaccine and people actually died. So if we look to Ebola, and Dr. Fauci was of course the leader, and he's my personal hero. I mean, he is just an incredible human being. And the Ebola epidemic, if you remember, many people from all over the world, the WHO, all of these international agencies got together. They were able to develop a vaccine in about 12 or 18 months and significantly reduce the death rate. The vaccine now protects and reduces the death rate by 85%. So the vaccine is the hope, but meanwhile, that's why we've taken these drastic steps of saying, look, we know that if you are staying at home, doing the physical distancing, washing your hands, that we can significantly reduce the spread of this virus.
That's all we can say is that inshallah, that will be achieved, and sooner rather than later.
Yes.
But in the meantime, we're being told that we have to make sure the economy doesn't tank, and so we have to send people back to work. People are roaring to go back to work. And should we were talking about sometime in late May. Should we look at that with trepidation or with optimism? And is this an issue per state? Like, what if Maryland says go to work, and then Virginia says not yet? How do you see all that?
Well, I think that we have to have science and public health and the clinical community be the ones to weigh in on that. That's not to minimize the suffering that people are going through given the economic crisis, right? But again, that points to federal policy, right? In Canada, every person is getting $2,000 a month. In France, 85% of your salary is still paid. Here in the United States, we have the worst of all possible worlds, right? Because during this time, if you can believe it, people who were on food stamps had a cut, not an increase. We saw 900,000 gallons of milk being just poured out because they wanted to keep the cost of milk at a certain amount. Did you know that in regular times, 50% of the food that is grown by farmers in the United States is actually put underground and not picked to keep the prices at a certain level? So it's not that we don't have the resources to be able to take care of each other collectively. It is related to the policy. Now, going back and sort of answering your question, how do we go back? I think that we have to have a regional approach. So for example, here in DC, the governors of Maryland and Virginia are working with the mayor of DC to have a regional approach. The same thing is happening with New York and New Jersey. We are not all going through this crisis at the same time. It's like a wave, right? Just like it started in China and then Italy and Europe, and now it's coming to the United States. And we really should think of the United States as really being like 3 or 4 countries, right? Rolled into one. It's not, I mean, yes, it's one country, but it's heterogeneous. So I think this idea of rolling, opening up the economy in stages becomes important. You have to sort of balance it, and you also have to have the flexibility to say, if we, let's say, open up to some industries and all of a sudden we see that the numbers are going up, then we have to close it back up. But I think that this idea of one size fits all doesn't make sense. But I would also put a great deal of responsibility on the federal government. And I would just add this: it is shocking, it is irresponsible, it is shameful and actually criminal to think that this current administration was calculating that maybe it was worth 2 million people in the United States dying so that the economy would not tank. So this is the reality that we're dealing with here.
So to put it mildly,
I'm back, I'm sorry.
It's okay. To put it mildly, if we are told that we should go out and work, we should be extremely cautious, because that's an opportunity for either a reinfection in the state or an infection of whoever.
Well, yeah, and so I have to say that the governors, the mayors have really stepped up and exhibited unbelievable leadership, right? Because ultimately, they're the ones whose people are being impacted. I think, I can't remember who said this. When one person dies, you pay attention, but when thousands and thousands die, then it becomes just a number. So I think that this sort of local approach becomes important, because these are people's communities. It's not just abstract. It's not just happening, overseas. And I do want to add something, because this is true in the United States. I mean, you saw how the president kept saying, oh, well, this is not going to happen here. I think that really speaks to this notion of American exceptionalism, that somehow America is protected. And if nothing else, this crisis has shown we are one planet, we are one race, which is the human race, and what affects one affects all. We cannot act like we are separate. The weakest of us really reflects all of us.
Actually, now that you say this, from my conversation with people overseas, they're sort of disappointed and surprised that we were not ready enough with all the PPE, like the masks and the tests and so on, like other countries. What we usually used to call in the 60s, the third world countries, are doing better, I think, than the US and China. So this is a weird...
Well, again, that speaks to the fact that other countries, especially in the developing world, recognize the importance of public health, right? Yeah. Public health is so key. And when you look at what's been happening here, there's been cutting of all these programs. All of the various institutions of the state have been completely undermined. And I kind of joke, but it's true. Egypt, for example, has been a country which has been in existence for thousands of years, just like many other countries, whether it's Iran or China, etc. And the reason that it has existed for so long is because the state was important, right? The state and all of the institutions of the state. So you have somebody that's in the administration that basically said, corporations are it, forget the state, it's not important, and now we're paying the price. And I just want to add one more thing. The United States has been number 37 in terms of healthiest country, number 37. You know, people are saying, USA, number one. No, that's been a myth. So I think that this whole crisis has exposed really the reality of what's been happening in the United States.
So maybe that should lead us to think about what we ought to be doing in the future, learn from this, improve our medical insurance, among other things, and our whole attention to the role of government in public health. Maybe we can start closing on this, and maybe you can say a couple of sentences about your interest in other social policy issues and health issues, such as, I know you've been interested in educating about breast cancer, for example.
Sure. I want to just clarify, many people think that access to healthcare is what determines whether people are healthy or not. And if it were, the United States would be number one, right, in terms of access to technologically, quote unquote, superior treatments. And you mentioned breast cancer. I had breast cancer. I was the beneficiary of getting A++ treatment. But when you look at what actually contributes to our overall health, that only accounts for 20%. 80% of our health is actually related poverty, education, the food that we eat, the water that we drink, the air that we breathe, the economic health of our community. And, you know, we have this in our faith tradition, you know, that saying where if poverty was a man, we would kill it because poverty is just so bad. So when we're looking at how do we make ourselves, our families, our communities healthier, education is key. You know, making sure that we have enough food, eradicating poverty, which of course from our Muslim sort of faith tradition, social justice is really a cornerstone of that. So my work in terms of helping to end health disparities through the Rodham Institute, which I established 7 years ago, in which people can visit the website, or being a physician for that matter, that is service, right? That is service. And we, as Muslims, of really anybody from any faith tradition, and really people from, as human beings, social justice is very important, and eradicating poverty, increasing education is just basic and key to preventing such a disaster from happening like this again.
I think this is wonderful to hear from you, and I would like very much to have you come over again and talk about social justice. And I'm sure there will be some questions generated by the audience of this lecture, and we will submit them to you so that we can have another session. Another very quick question before I round up this interview, like we have a couple of minutes. I understand that there is a cardiac side to coronavirus. So I'm thinking of inviting maybe Dr. Reiner to see if we do this lecture. But what is your quick comment about this?
So we, as people get sick with the COVID or the coronavirus, especially the people that get very sick, we are finding that up to 20% can have their hearts affected because certain viruses can actually attack the heart. Fortunately, a certain percentage resolve, especially with young people. You can imagine if you already have pre-existing heart conditions, that can be more challenging. The lungs are actually primarily the organ that is impacted more for the long term. So I think I'd be happy to get one of my colleagues who's a pulmonologist to come and speak to this issue.
We're going to count on that. And I think this has been wonderful to meet a doctor who is not only so very well informed and one of the stars of George Washington faculty, university faculty, but also somebody with a social justice consciousness, and who has this rooted in her faith, which we believe is very important for us to get through these stressful times.
Well, I have to tell you, I have to say that everything that I owe is to my parents and my grandparents. This is how I was raised. This is sort of, and I think maybe my parents paid you for that lovely endorsement. But it's been, in all seriousness, it's been my pleasure. I'd be happy to come back whenever you would like.
Thank you so much. And I guess we can all say Alhamdulillah for what God gave us, especially in teaching us how to be clean and how to deal with adversity through faith. And thank you so much for all the wonderful things you shared with us today.
My pleasure. Alhamdulillah.
Dr. Bayoumi, thank you so much.